Covering something which has not been already discussed. Councillor Wade?
You said we've got 40 ambulances in Shropshire.
Roughly 30 will be on duty.
Okay, Shropshire is a third of the size of West Midlands. We need more ambulances because we're a third of the West Midlands and mostly rural. 40 doesn't cover us. It just doesn't. Can we not move some of those others into our part? Because we're a massive county.
Yeah, I guess. So we put the resources where the demand
people
is.
are.
Yeah. I'll give you one interesting piece of it's a bit historic. I don't know, you might remember if this was done. It's going back in time actually. So we were asked, what would it take to deliver response times in Shropshire? So not because we're measured at trust level. We're not measured by county or by postcodes or the trust level. We were asked by our CCG, Shropshire CCG, what would it take to deliver? And I'm going back a few years, but for us it was a doubling of workforce and 2/3 additional of our fleet. So there is a big resource gap, but that starts to get into again a commissioning discussion, which is why this isn't just about us, it's about our partners as well in terms of what is it that people want to have in this part of the world and the priorities that we've got.
Councillor Thompson?
I was wondering if you knew how many first responders there were in Ludlow and whether getting more of those might help a lot.
So it's a good question. I've got a set of notes here, and one of them says community first responders, but so community first responders would absolutely welcome support to develop more schemes. I don't know the actual numbers we've got in Ludlow, so I've not to have it, I don't know. Community first responders, absolutely, we would welcome support with, because actually community first responders can make a difference when it comes to particularly things like cardiac arrest and where it's about CPR and it's about the difference in life and death in cardiac arrest. So we would welcome support to the council around CFR schemes and also having more AEDs situated as well. So you know the defibrillators that you get on the roadside.
So would a recruitment campaign be something that you could actually do?
So we do, but the charitably, this community first responders are actually volunteers.
Yeah.
So we support them, and we welcome everybody's support in trying to establish more of that into part of the world. Absolutely.
There's two, isn't there?
Okay.
Thank you. Councillor Garner?
I think we've all heard and articulated very well why the problems are occurring, but I haven't heard exactly what your solution would be. And also I think the issue is not just the ambulances, a big part of it is the handover to hospitals. So what are you doing together to create more ambulances and more space in the hospitals to receive the patients? Because those are the two blocks.
So we can't sort this alone. The sort of solutions I've gone through around things like clinical validation, use of alternative pathways, our own recruitment, in of itself will not be enough to rescue this and turn it around. It won't be. I need to be very honest about that. It is not going to be enough. We can't solve this alone. One of the complicating factors that we've had, and it's kind of shone a light on a poor process, and everyone's been a patient at points in time. Pre-COVID, most hospitals had corridors full of patients, and that's pretty grim in itself, and it's not good care. What then happened with COVID, of course, is that because of infection prevention measures, those patients couldn't be just all grouped together inside corridors and in the hospitals, so they stay outside. But of course, what we've now got is an extension of our hospital outside using ambulances as more cubicles, and that means they're not able to respond. Shrewsbury and Telford, I've been there a number of times. They don't have the size of the footprint and infrastructure they got doesn't lend it that they need more space to work from. They don't have it. The other thing is there's clearly congestion all the way through. As we're sat here today, there's got to be patients who are fit to leave that organisation, but they're probably still sat there tonight while we've got emergencies queuing outside. So it's a contribution that's needed from everybody, and it'll be the sum total of it that will make a difference. But us in isolation, no, I don't think we can turn it around in isolation.
So
Quickly, please, yeah.
I know you're going to submit some statistics in terms of response times, but you probably know off the top of your head the difference between if I was a patient in Ludlow and I ran for 999 and I ran from Shrewsbury. So could you give us an indication of the differential between the two areas?
I don't know off the top of my head. What I can give you though, I can, put it in action for me, I can absolutely give everybody a postcode breakdown, so SY7, SY8 versus SY1 and others. I can absolutely do it, no problem.
Councillor Gill?
Like Councillor Garner, I actually didn't hear any solutions. And from what I hear from you, we're actually going to see the situation deteriorate further. Because nothing you've said or explained suggests how things are going to get better for people in Ludlow. And I can just see things getting worse and worse and more people dying. At the end of the day, it takes 45 minutes from Shrewsbury to Ludlow, if you're lucky. Or if on some night, it'll take you an hour 15. So, I've heard nothing that suggested any solution. Well, all I've heard suggests it's going to get worse. Do you think it's going to deteriorate further?
So the current signs are things have stabilised, but in a very bad place, actually. So the sort of numbers around response times, handover delays, and things like that have plateaued a little bit as we come out of December and January. But it will take a concerted effort again between us all to get it going back into the other direction and giving a better response to patients. And as I said, that's not something we can do alone. The scale of the problem is well in excess of just the ambulance service alone.
Councillor Tapley?
Can I very much oversimplify? You've made a very good defence of the system, and it seems to me that it's working just about as well. You've more or less convinced me. But you just haven't got enough resources.
So it's interesting you make that comment, because I don't think I've tried not to defend what isn't defendable, actually, because as I stand, it's not defendable. Is there a need for more resources? Clearly yes, but actually it's not just with us, to be fair. So if somebody said, here's another 100 ambulances tonight, we'll get to the next 100 patients. 50 of those will be quite quickly stuck outside the hospital and joined by the other 50 because they're gridlocked. We've got gridlocked. So the answer isn't actually necessarily just resourcing us, I have to say. As much as you might say, well, the ambulance service needs all the resources, actually the resources needed elsewhere because we've got patients waiting on parts of our healthcare care system. So it's not actually it is a resourcing matter, but I have to say it's not just one of the ambulance service.
Yes, I meant as a national point.
As a national point, yes. But there's something about the West Midlands that's making it, and we don't understand this, why it's so particularly severe in the West Midlands versus other parts of the country. Southwest is struggling quite considerably in some parts. But yeah, there is a national point. It is a national point.
Right, thank you all very much indeed. We have given a very large amount of time to this tonight because it fully deserves that time.